changes and cuts are going to lead to the loss of service and the possibility that some of the country's 760 at-risk, financially strapped rural hospitals could be forced to close, hundreds of them. That's why some Republican senators like Susan Collins fought for a $50 billion fund for rural hospitals, although that may still not be enough to prevent some from closing. The One Big Beautiful Bill Act is a big step backward for this country's healthcare system. For more on this, I'm joined by Robert Reich. He's a former Secretary of Labor during the Clinton administration. He's a professor of public policy at UC Berkeley. He's the author of the forthcoming book, Coming Up Short, a memoir of my America. Bob, it is great to have you on the show. You and I talk with great regularity, but not as often here on Velshi, so I'm glad to have you here because this is a really, really important issue. You and many others have said that this bill, putting aside just the health care stuff, represents the largest upward transfer of wealth in U.S. history. Former HHS Secretary Kathleen Sebelius told me on Thursday night this is also the largest cut to health care that we've ever seen. I want to get your take on this.
Ali, in historical terms, and we have to just kind of look at this comparatively, this country has been making progress. It's been making progress on healthcare. It's been making progress on other kinds of public investments. We were way behind other advanced nations, OECD countries, as you put it. But this, for the first time, marks a decision by effectively the United States. Obviously, most Americans, if polls are to be believed, are against this. This marks a decision to go backwards. It's a regressive step. Not only are we taking Medicaid from working class and poor people and uninsuring them, but we are using much of the savings to provide a very big tax cut to the richest people in this country. And at a time when the gap between the rich and the poor is as great as it has ever been. Sometimes I refer to this as the second Gilded Age. We had a first Gilded Age between 1880 and 1910, that when inequality became extraordinary. Well, we are now in a second Gilded Age. And what are we doing about it? We're giving a big tax cut to the wealthiest people in this country and cutting health care for poor and working class people.
So you study these things around the world, and it's important to remember that when you provide, in all those OECD countries that provide some form of health care or health insurance, that provide universal health care in some form or other, the cost per person is lower than it is in America, and in many cases, most cases, the outcomes are greater. And when I say that, we can use all sorts of statistics, including lifespan. I mean, there are definitely some things that are super advanced in America in terms of certain cancer cares and things like that, but generally speaking, those other systems cost less and deliver more.
Yes, we are the only advanced country that has a system that costs, well, almost, right now, we're almost 19% of our entire national product. That is way much more than any advanced economy spends. But we are also the only major economy that is seeing some decline in health outcomes. We actually don't have nearly as good a lifespan and as long a lifespan as many other advanced countries. How can that possibly be? We're spending so much more, and yet we're getting less. The answer has to do with the fact that our system is a corporate for-profit system. And when you have a corporate for-profit system, you are almost invariably going to have a lot of that money that we spend going into shareholders, into the pockets of CEOs, into a lot of ancillary companies that really are not producing healthcare outcomes that are good healthcare outcomes.
And the argument has always been that somehow, because of this unusual system we have, that you have more choice. But the fact is, for low-income people, you could be left with no choice under these cuts. So it's not a choice. You can keep your doctor. It's like you won't get to see a doctor. You won't get the treatment you need. You won't find out that you have diabetes or heart disease that needs treating because you just won't go.
Yes, and that's one thing that also drives our costs. We don't have a system of preventive health care. So people are not, who should be, they're not seeing doctors. They're not preventing chronic conditions from becoming really serious and extremely expensive. The other thing I want to mention, and this is a political point, but it's a very important political point, Ali, is that the impact of these cuts are going to be felt in a huge way in red states, because it's not just poor, it's also working class people. It is not black people, brown people, it's mostly white people. These are people who you would expect that the Republicans in Congress who went along with this bill might pay some attention to, but the bill is going to come due in 2028. I mean, it's been carefully timed, so these cuts don't really happen until after the midterm elections.
So let's talk about this other issue, and that is these rural hospitals, or rural. It's more than rural hospitals. It's sort of healthcare in general in rural areas. You may think you've got nothing to do with Medicare or Medicaid, but if a hospital depends on funding through Medicaid and it loses that funding, you lose your hospital. You lose your access to doctors. So this idea that this only touches people on Medicaid is a fallacy.
Absolutely. I mean, it is a critical part of our healthcare system overall. About 40% of our children actually depend on Medicaid for their health insurance. Many seniors are dependent on health insurance from Medicaid. And it really is something that is one of the building blocks, foundation stones of our healthcare system and our social safety net system. This is why when Donald Trump continues to say we're not touching Medicaid, we haven't touched Medicaid, it is so bizarre. People will discover, sadly, that they don't have it.
You know, the interesting thing about Medicaid and SNAP, food stamp benefits that are being cut, is that nobody gets rich off of these things. It's very hard to game the system. If you're on SNAP, you're getting so little per meal, you're not gaming the system. If you're on Medicaid, you're not gathering and squirreling away extra medical care. You're going to a doctor. You're getting something done. It does seem strange that in order to pay for this massive tax cut of more than $4 trillion, we've cut everything we can try to cut out of things like SNAP and Medicaid. It seems like basic injustice.
It is injustice, and the word injustice is a very important one here. I think Americans have a fundamental understanding of what's fair and what's not fair. They understand injustice. And I believe, Ali, that when the smoke clears and people understand what's happening with this big, ugly bill, that a lot of people are going to say, I don't know how this happened, but I am appalled. I'm appalled that my Republican representatives went ahead with this. I'm appalled that Donald Trump supported this, was really the guiding light behind it. I'm appalled that America has come to this. This typifies injustice.
Is this an opportunity for those of us who think that there should be, certainly, let's just apply it to healthcare, a fairer system that better represents other developed countries in the world, to remake that case to Americans, to say, forget about going in the wrong direction. Let's go full speed in the other direction?
I agree with you completely. I think that one of the silver linings on the very, very dark cloud we are now under right now is that there will be an understanding, a deeper understanding by many more Americans of what we have lost, what we had, how valuable it was. There will be a backlash against everything that's going on, and we may find ourselves, if you go back to the first Gilded Age I was talking about in the 1890s to about 1910, there was a backlash against that inequality, that injustice. It took the form of the first progressive era in America, in which a great deal of very important legislation was made in response to the injustices of the first Gilded Age. I think we're going to see the same thing.
On a day like this, we could use that silver lining. We appreciate it. Bob, it's great to have you on the show. We hope we can get you back more often. Robert Reich is the former United States Secretary of Labor. He's a professor of public policy at UC Berkeley. He's the author of the forthcoming book, which we'll talk to him about on this show. Coming up short, my memoir, a memoir of my America.